When I think back to try to determine in my mind if there were some signs that I missed because I saw none of this coming, the only thing I can pinpoint is I was having back-to-back urinary tract infections. And I went to my doctor in Burlington, and I said, I've had a urinary tract infection. Okay, let's do a urinalysis. Yes, Miss Walker, you do have a tract infection. Let's get some antibiotics. I would do that. It would go away. In a few months, it was right back. And my sister said to me one day, she said, Willie, did you ever get an appointment with Dr. Kaiser? I said, no, but I think I'll try again. And I did try again. And I'm thankful that I did, because had I not gotten in with Dr. Kaiser as my doctor, I might not have been here today. When I first found out my diagnosis, I was a patient here in the hospital. I had really gotten myself run down. My daughter discovered in February that she had pancreatic cancer. And I just moved in with her to take care of her, and it was just, I was doing that, and I had really gotten sick, and she passed in May 5th. And I thought I had a cold, and then I was told it was bronchitis, so I decided to come to Dr. Kaiser. Dr. John Kaiser is my doctor here. And he wanted to admit me because he thought he saw a little pneumonia on x-ray. So he did, and it was actually while I was here in the hospital that through x-rays that discovered I had ovarian cancer. They did a CAT scan, x-rays, and then a CAT scan, and they came back. And at that time, I was developing fluid. So they came and drew some fluid off, and they found the cancer cells in the fluid. One afternoon, this nurse came in, and I hadn't seen her before, and she said, I want to talk to you before I leave. And that night she came to my bed, and she said, I had just discovered I had ovarian cancer. She came to my bed and she said, I'm Rebecca. I said, you can call me Becky. She said, I want you to know that where you are going, that you're going to be just fine, because they told me that they were going to move me to the women's part of the women's hospital. She said, where you're going, you're going to be just fine. The people are so kind over there. They're so nice. And she said, I worked over there for 3 years, and they're just wonderful. And she said, it's one doctor, we stole him from Duke. She said, and he wears nothing but bow ties. So when I got the doctor with the bow tie, I was really amazed, and I was kind of happy because she had pointed him out. And honestly, he is so wonderful. He is so kind. Dr. Clark Pearson takes the time. He has the time to talk with you. And I only had one daughter. She's the one that died. And my sons would always come with me, and he always took the time to to greet my son and to answer questions for my son. And Lynn, that works with him, is just the greatest. I could call anything that went wrong. If I had a question or a problem, I put in a call to Lynn, and in 15 minutes, Lynn has called you back. And if, I was getting blood work in Burlington every week. If it was something, I got my blood work on Tuesday. On Wednesday, I was getting a call from Lynn. Whether it was good news or bad news, I was getting a call from Lynn. They are the greatest team. And the people in the chemo department, the sweetest people in the world. I'm in remission. I see him August 26th, and that would be 6 months of remission. Well, I read this article in the paper, and it was saying that ovarian cancer is one of the silent killers. And two things women should look out for. One is bloating. Not just don't think it's something I ate, that my stomach is bloating, and frequent urination. First, I thank God. Then I thank God for leading me to Chapel Hill. Because honestly, if I had not been a patient here, I don't think I would have been alive today, because I had no idea I had cancer. And I would have just ignored it. I feel that God put me with the best that He had. Honestly, I really do. I feel that God put me with the best that He had. And I think that's Dr. Clark Pearson.